All right, welcome back, everyone. I hope you have had a healthy and nutritious lunch filled with nuts and berries and dark leafy greens, all sorts of things that are good for your brain. As I said before, I am Allison Schooler. I am the President and Chief Scientist at the Center for Aging and Brain Health Innovation, as well as at the Baycrest Academy for Research and Education. And Baycrest is one of the organizations that's part of the Toronto Dementia Research Alliance, along with CAMH and I can't name them all, so Sunnybrook and Cherry Shores and all. I'll let you tell them all. But each of us has a slightly different focus for the kind of work that we do. And the work at Baycrest in our research institute, the Rodman Research Institute, is really focused right now on what we're calling precision aging. And our goal is to use precision medicine, the precision medicine approach, to do for aging and brain health what it has done over the years for cancer. So when I was growing up, if someone was diagnosed with any form of cancer, you didn't even talk about it, because whether it was breast cancer or prostate cancer or any other sort of cancer, it was effectively a death sentence, and there was so much stigma associated with it. But over the years, because of the approaches of precision medicine, and what I mean there is like understanding what is your environment like, what's your body like, and how can we adapt things for you versus you versus you. We now know that there are more ways to reduce your risk for cancer, to catch it earlier, to diagnose it in a really precise way, and to treat it. And that's what we're aiming to do at Baycrest. We want by the year 2050 to have no new cases of dementia being diagnosed, nobody moving into long-term care because of dementia, and nobody dying from dementia. And I know that that sounds like a really ambitious goal, but I feel like if we don't shoot that high, we're not going to get even close, right? So that's the goal for us. The one thing that's a little bit different about our approach to precision medicine in aging and brain health compared to the standard approaches in cancer is that in cancer, people typically think about precision medicine helping more in the diagnostics and the treatment side. Whereas at Baycrest, what we're really focused on is the entire sort of lifespan, if you will, of aging and brain health and dementia. So starting at prevention, what is a personalized way we can create, say, a personalized longevity, a personalized brain health prescription for you? And that would be different than it would be for you or for you. So how do we help each person prevent dementia to the best of their ability? How do we detect it as early as possible and have the right kind of diagnostics to make sure we're diagnosing as early as possible what form of dementia it is? How do we treat it in the best way for that individual? And how do we care for people in a really personalized way who are living with dementia? So we've got these 4 buckets or pillars, if you will, from prevention, detection and diagnostics, treatment and therapeutics, all the way through care. So in a nutshell, that's the kind of work that we're doing in our research at the Rodman Research Institute at Baycrest Academy. But we also are very, very much committed to this idea that it's not enough just to publish papers in Nature and Science. It's not enough to advance the science even. It's not any good unless we get it into the community, unless we're sharing the knowledge with others. And that's what I'm going to talk a little bit now about today is our Defy Dementia program, which is really about sharing knowledge with people about what are the lifestyle changes that you can make that will reduce your dementia risk or slow the progression of the disease if you've already been diagnosed. So I just want to give a shout out to team members. There are a number of team members spread throughout the room, and there were more at our table if you saw them during the lunch break. So maybe just Baycrest and CABI people raise your hands so people can see who you are. So there's a huge, huge team that's been involved in this Defy Dementia project. We have just a couple of the folks here. And if you listen to the podcast, there's somewhere we thank everybody. But it's not me alone. It's not Jay Ingram, who's my co-host on the podcast, the two of us. There is a huge team of us working on it together. And the initial funding was from the Public Health Agency of Canada. So I'm just going to quickly go over a little bit of background on dementia and the prevalence, and then we're going to get into the risk factors, and I'll show you a little bit about what the Defy Dementia program really is like. Before I get started, I want to just find out a little bit more about all of you, right? So can you raise your hand if you are a scientist? okay? Or including trainees, you scientists in training, that counts. Raise your hand if you're a clinician, okay? Raise your hand if you're a caregiver, okay? And raise your hand, well, you don't have to raise your hand, but if you want to raise your hand, if you are living with dementia or have been diagnosed, you're welcome to raise your hand, no requirements, obviously, okay? So, and raise your hand if you've known somebody at some point during your life who has been a caregiver or living with dementia. Everyone's hand probably is going to go up at this point. So dementia, as that you've already heard earlier, is not just one thing, right? People often will think it's Alzheimer's disease, but it's actually a term that covers a lot of different kinds of disorders. Alzheimer's is the most common, but it also includes Lewy body disease, vascular dementia, frontotemporal dementia, Parkinson's-related dementia. There's a whole bunch of other sorts of things. There's HIV-related dementia, et cetera. So, and often there's more than one kind of dementia that's built into this. It is right now affecting over 50 million people, and the rate of people who are being diagnosed with dementia is increasing. So every time I'm snapping my fingers, which is about once every 3 seconds, somewhere in the world is a new dementia diagnosis, right? And as the world is aging, you can see what's happening, right? Because age is the biggest risk factor for dementia. Now, the prevalence in Canada itself, you can see all dementia cases from about now, which is on the far left, all the way through 2050. You can see it's expected to grow from about where we are now at about 750,000 up to almost 2 million people within Canada if we don't do something to slow the progression of this disease. In Ontario itself, as I mentioned, age is the biggest risk factor for dementia, and this is part of the issue for us, is that if you look on the top, you'll see that the numbers of the people in this population over 85 and even over 100 is growing much faster than it is in other parts of Canada. So that's increasing our lifespan, but also our risk for dementia. And then some of the factors that we know can increase your chance of dementia are shown on the bottom. The good news for Ontario is that some of those risk factors, like heavy drinking, obesity, smoking, are actually lower in Ontario than they are in other parts of Canada. But notice the physical activity. Canadians who live in Ontario are experiencing a much lower rate of appropriate amounts of physical activity than they are in other places. There was a question in the sleep session with Dr. Lim that people were asking about folks up north. And I was just up north, not maybe as far as where it's 24 hours, but we were just up in Whitehorse doing some presentations with folks in the community there. And what was interesting there was, yes, they might have longer days and might be a little bit harder to sleep, but their physical activity is much higher. Right? So there can be these trade-offs. And when he was saying, well, yeah, they maybe don't sleep as much, but maybe they're exercising more. So there can be these kinds of trade-offs. Now, these are the most recent list of risk factors, one of the most recent lists of risk factors for dementia. There are some things that we can control, and there are some things that we can't control. And again, we've talked a little bit throughout the day about some of these. Age, your sex, your genes, those are things that right now you can't really control. So women are more likely to be living with, say, Alzheimer's than men, and it's not just because they live longer. And there is a risk factor associated with certain sorts of genes, particularly for certain kinds of dementias. But what's really interesting is that at least 40% of the risk factors for dementia are things that you have control over in your everyday life. Right? So some of these are things that start earlier in life, like your early childhood education. Some are things that can start to change during your midlife, 45 to 65, including hearing loss. We heard recently about hearing loss. The good news is, for example, and we'll come back to this, hearing loss, if you're working on it and you're treating it and you're using your hearing aids, then that actually seems to decrease your dementia risk, so that's great. And then there's other things in later life that seem to be these risk factors as well, and we'll talk a little bit more about some of those. And one of the things that we wanted to do was to let people know that there are things that you can do to decrease your dementia risk. There are changes you can make in your life to reduce your risk or to slow the progression if you've already been diagnosed, right? And so that's really what the Defy Dementia program is all about. And what Defy Dementia is a multimodal knowledge mobilization extravaganza. Is that a fair way of putting it? So it has a podcast, it has infographics, it has short 1-minute videos, it has a website with resources, it has the game that we showed you earlier, and it also has an amazing co-host, Jay Ingram. Has anyone heard of Jay Ingram? Raise your hands, yeah. So Jay Ingram, and he and I are the co-hosts of the podcast, and we're very fortunate to have, as I said before, a great team, including Ben Schaub, who's over here. Ben, raise your hand. Who's worked with Jay for decades, I think, three decades, at Discovery Channel and so many other places. So adding a level of professionalism to the podcast that we definitely wouldn't have had without. And the way it works basically is that each of these podcasts has focused on a different risk factor for dementia. So the first one was focused on sensory loss, your hearing and your vision. We covered loneliness and social isolation, cognitive engagement, exercise, nutrition. Episode 6 is just me and Jay having a conversation about our New Year's resolutions, what we're going to try to do to change things. And if you listen to that one, I am sleeping a little bit better now, so don't worry about me. Environment, including air pollution, sleep, and actually Dr. Lim was our guest on that one of our guests. Keeping it simple is sort of a summary of where, catching up on where we were. Stress. There was a question earlier in the morning about caregivers, and there are some statistics for people who are caregivers for folks living with dementia that you can be up to 6 times more likely, it can increase your risk by up to 6 times, but that's not, as you said, I think before, it's not because it's contagious, it's because if you are a caregiver, you're taking care of someone else instead of taking care of yourself. So the main point of that one really is take care of yourself as well. We have our next episode coming out soon on genetics. And I just want to show you very quickly, if you're not familiar with podcasts, what some of these look like. So if you go to the Defy Dementia website, which is shown here, it will take you to the landing page for the very last episode, right? So that's shown here. And our last episode that I mentioned was caregiving. And I want to go to the first episode, which is census, so I just click there. And then it has a summary about what the episode is about, some key takeaways, highlights, quotes from the different guests that we had. It has a very brief animated 1-minute video, and it will have an infographic, and I'll show you those in a sec. But I'm not going to play the whole podcast, obviously, but just so you can hear a little bit about what it sounds like. This is the very first episode.
My brain was muddled, and I was calling it mental fatigue. I would get home from work, my husband would look me in the eye and he'd say, yeah, you're toast. You've spent too much time trying to listen today and trying to understand.
That's Laurie Harris. She's a British Columbian with a compelling life story about how partial deafness has impacted her life and her brain. You'll meet Laurie in a moment.
So each episode is starting with, or typically is starting with a person with lived experience. And we heard how important it is to hear the stories directly from people with lived experience. And then we have a scientist or a clinician listen to that story and respond to it and provide more information about what's happening in the brain related to that particular risk factor, and more importantly, what can people do to decrease their dementia risk. And one of the things that I mentioned is to understand hearing loss. And just as a little aside, if you're interested in whether you might have hearing loss, we actually have a free online screening tool at Baycrest, and we can make sure everyone gets the link for this later. It's absolutely no cost. You just need to use headphones because it tests each ear separately. And just a little quick aside on this, last time I visited my parents, they'd been married for, 50 years or something. I thought they might get divorced because they were just fighting all the time. And it turned out it was because they're both losing their hearing. So my mom would be like, Robert, you're mumbling all the time. And my dad's like, Sue, you never do what I ask you to do. And And I said, you guys can't hear each other. So I had them both take the hearing loss. My mom now has hearing aids, and there's marital bliss once again. So it's worthwhile taking that test. In terms of the videos, this is an example of what one of the videos looks like. This is the first one from vision and hearing. So, vision and hearing changes are a part of life. Those changes in your hearing or vision can greatly increase cognitive load.
In other words, when it becomes difficult to hear or see what is happening around you, more mental effort is needed for hearing or seeing, leaving fewer cognitive resources available for other things, like remembering what you heard or saw.
So what can you do? Take sensory changes seriously. Even if you don't think you have a problem, get your vision and hearing tested to establish a baseline, or to know if things have changed for you.
If they have changed, use hearing aids or glasses to decrease your cognitive load. By doing so, you can continue to engage with the world around you and decrease your dementia risk.
So each of those episodes has just a very brief 1-minute video, and that little brain character shows up in every one of them. You get kind of attached, that little brain guy who's going around. And then we also have an infographic for each one. This is the top half of it, which talks about what is the issue, and then also importantly has how can you take action. Because again, we don't think that understanding what's coming out of the research and the science is useful unless we give people advice on how can they take action in a way that's going to make their lives better. For folks who are francophones, we have it also everything's in English and in French. So feel free to, if you're not a francophone, actually learning a second language can be good for your brain. So you can sort of listen to everything in English and then in French. You can access all of these again for free, just at defydementia.org. Or if you're listening to podcasts, you can just go anywhere that you get podcasts, Apple Podcasts or Google Podcasts or Spotify, wherever. We're everywhere. And a shout out to the team because the podcast actually was nominated for a Webby Award this past year. Thank you. But I'm a dual citizen. The Canadian in me says, it's an honor to be nominated. The American says, I wanted to win. But we were in the same category as Sanjay Gupta, so guess who won? But that's okay. But I think just being nominated there. I think for us it wasn't so much about for us it was really about raising awareness about this issue of dementia and aging and brain health and what we can do to help people learn how they can take control of their own lives. You can't necessarily prevent dementia for sure, but you can do things that are going to slow the progression of the disease. You can do things that are going to decrease your risk. And one of those, as I mentioned before, is cognitive engagement. So if you didn't get a chance to play the game, you can scan the QR code or just go to brainhealth.kanoku.ca. And that is everything I wanted to share with you today. So thank you very much.